nutrition through healthy eating and active living, and more specifically, how he as a business owner has and continues to use his platform to encourage community health and fitness. He has had tremendous success with running and walking groups, and has used company events to provide philanthropic benefits to local organizations that impact structures directly used for exercise in the community, as well as to organizations that conduct research and services for those in need. So, John, how have you used your business platform and model to promote health in your community? What has worked? What hasn't worked? What would you do differently?
Well, I think our platform starts with our 5 core values, which is put people first, accessibility, inclusivity, community, and do the right thing. And I think that those core values drive our business within our community. Community is an important aspect of that. Probably the biggest thing that customers say when they come in is, I'm not really a runner. Well, about 40% of our customers are medical referrals. Probably another 40% are walkers. And then the rest might be serious runners. So we cater to a very diverse group, but not necessarily a what I refer to as a vertical customer that is just about running. These people are putting and trying to put fitness into their lifestyle, not their lifestyle into running. So the main thing is really to, how do we change people's lives with those core values? And the biggest thing is making sure that we get people moving. So we do offer training groups that are for beginning runners. And that's just to get people motivated and trained and with advice on how to complete their first 5K. We invest in our community facilities such as Portland Trails. That is the foundation for Portland to get people moving because it's a trail system that people can get on and utilize. So I think the other thing is just our employees and the way that we connect with our customers to make them feel inclusive to our business. And then when they have that comfort level to feel the support that we're going to offer them, whether it's product, getting them moving, or if they have a question from a physical standpoint or an injury prevention standpoint, all those things that we do provide, again, a complete running or walking experience for that customer and allows them to, achieve their goals.
That's great. And this fits in directly to what we've been talking about in terms of chronic disease prevention. 2 primary factors in preventing these diseases are healthy eating and active living. And it's harder than it sounds, and it's often not an individual choice. A lot of times it's accessibility and the product of an environment, which kind of leads to a social ecological model. It's not just an individual, and individuals don't always have a choice on their behaviors or their health outcomes. But, if the structure's there, if the natural environment is there, if the community is there, then it does make it easier for people. And just generally being physically active for 20 or 30 minutes a day at a minimum. And I think you've done a great job with getting that messaging out, especially with the beginner walker runner groups. I know you've utilized a lot of different outreach platforms too. Do you want to speak to anything like that? How do you get this messaging out to people that this kind of service is available?
Well, a large part of it is word of mouth, and then a large part is done through the social media. It's building upon a good experience from the people that have joined our clubs or have joined our training programs. Often those training program beginners evolve into our club, which is more of a social club, but with coaching available. And that community feel of doing something together helps motivate people. For example, we'll have a Winter Warriors from December to March where we'll have 160 people involved. And all those people want to just have sociability to be able to get through the winter. And we set goals for them.
Get through the winter.
they don't show up every day, but for the most part, we have pretty large groups that take part in that. As far as community outreach goes, our biggest goal is to really extend our brand and what our core values are within the Portland running community. So, for example, we sponsor the weekly Back Cove series, which we've been doing now for 12 years, where people can pay $30, and there's 16 certified 5K courses around Back Cove Trail, and we generally raise anywhere from $12,000 to $15,000 a year that goes directly to Portland Trails to help maintain and help the trail system be maintained. And we feel that that's a big part of our responsibility to our community.
Yes, that's great. And just having participated in some of those events, I can attest to how great the community is. And people are, they're there to compete with themselves sometimes too, but they're there because of the other people. So it really is an amazing social setting, which we know can also contribute to a positive health outcome, just having that social support. So you just sort of spoke about some of your philanthropic efforts, primarily to the Portland Trail System. How does that affect your business, positively, negatively? Can any business sort of just do that if someone doesn't know much about business?
Oh, I think it's a very positive effect on our business. It's been an entity for 12 years. We continue to keep it growing. People get a bib for all 16 events. They can go onto a website and see their weekly chart of progress or what their average time is. And there's a ranking system with the average time. But I think that it has a very positive, it's our favorite event. It's our number one event that we feel is grassroots oriented to building the fitness community in the city of Portland. So in terms of positivity, it has a very positive effect on the running community. Maybe this isn't a piece of it, but when COVID-19 happened, Portland Trails was one of the first mentioned events that people were sad about that had to be canceled because of that. So we know that we're reaching a positive level with our community.
Right. I think there's something to be said when there's something to look forward to. And it's great what you do with the sort of results tracking, and people can look at their results online. I think that just numbers in general can be really motivating to people. So it kind of keeps them going. They want to better themselves. Once you get in the first time, it can be sometimes intimidating, but once you get in and see how supportive the community is, everyone has, I think, like-minded goals that, they realize it's a really inclusive community.
And I think the thing about that event is it includes runners and walkers. We'll have people finishing at 15, 16 minutes, and we have people finishing at 45, 47 minutes. So everybody's included. The way that we support and support the event, people will stay around until that last person walks through. Feel that person is just as important as the first person. And I think that's the thing that really elevates our business beyond, some of the other businesses out there, is that inclusivity of all levels. So I think that's an important piece. The medical referral piece is also an important level. The medical community often refers a lot of people to our business. As I said before, it's 40% of our business. It's those frontline workers, it's the medical workers that are looking for good footwear that helps transport them throughout the course of their day. And so that's also a major piece of our business.
Yeah, and it's funny, we were just talking about this in a previous interview. Two things you just mentioned there: the ability for adults to participate in their day rather than feeling like you don't have the equipment or the drive or the motivation or the structure. So being able to participate in your day the way that you should or want to, and the collaboration between clinical entities and non-clinical entities is vital to public health. Can you speak a little bit to how you started that prescription medical referral program?
Well, no, we would just go out and meet with physical therapists, which is really the battleground or the frontline referral piece of our business, and we're well known within that faction of the medical community. So much so that we've added a physical therapist office into what used to be our community room with Finish Strong and Dan Frey and his group. And it's been a very complimentary piece to our business. So the real thing is really communicating, networking, educating, listening, making sure that it's a two-way street, you know, and really trying to support their patients as well as they become our customers, because we can help them alleviate some of that pain with not just footwear, but the other equipment that we carry in our stores.
Yep.
And we
That's
also,
great. And I think
we also refer customers to them. So
right. So those partnerships are so important. And that's another kind of message I've been carrying forward with this community health topic is, you know, the collaboration between people, but you don't have to be a community or public health professional. You can work in a running store, you can be a business owner, you can be a medical professional. The more we know and the more that we're aware of these different health topics and resources, the more we should share with other people so that other people are just aware of what's out there. I think a lot of it is awareness and just being kind to other people. You don't have to have a professional license to spread the word of health and positivity and things like that. So I think that's really important to know. And I think another great thing to add to that is, like, you've been really consistent with keeping those connections and relationships going. So it's now, I imagine it's not as much work as it was in the beginning, because you've had that consistency and that relationship, and now people just know. And so if someone needs a shoe prescription, they know that, oh, this is something that your store does because you've been doing it, you've kept it going, it's been consistent.
right.
Things like that. That kind of brings me to another question. Running shoes are a little expensive these days, but it's such a great investment for your health. And like you just sort of mentioned, it really helps you participate in your day in a variety of ways. What would you tell someone that kind of comes into the store with that preconceived notion?
Well, I think the bigger question is if you're coming to our store, you know that the shoes are going to be priced at a value that's going to correlate with what it's going to do to support what you're needing. So because we're a destination store and because we're getting the referrals and everything else, people expect to pay X amount to get that support and get that value out of the shoes. You know, we tend not to really talk about price because that's not what we're into. The shoes are to be designed and engineered to really support your activity, whether it's walking, running, support your gait type, support your body type. And that's our job, is to find that right combination that's going to help support all those things that correlate to that. So in some ways, price really has never been a factor in our business. On occasion it is, when somebody is coming in, maybe thinking that we're a sporting goods store, or thinking that we're not the specialty store that we are. But because of the entity that we are, and the fact that we're a destination store, we're a referral business store, we're a community-based store, people see the value in terms of the prices that they're going to pay, which is, you know, it's $120, which a lot of times is a lot cheaper than a medical bill. So
yes,
I think that's the way a lot of our customers look at it. Oh, I spent $80 somewhere else and I got the wrong shoes, and now I'm gonna spend another $60 to get the right shoe. So, you know, which they would have saved themselves $80 had they done it the right time before. And that's usually coming from a medical referral or a word of mouth, or somebody that's had a great experience with us and suggested it to that customer. So yeah, price is the price value relationship is always the value that the customer ends up with at the end of the purchase. So
yeah, that's great. And I think for sure, if anyone were to question that, just kind of going back to that prevention piece and how ultimately something like this that's going to allow you to greater participate in your day is ultimately preventing chronic disease and disability. So I think that's great to hear. Anything else you would like to share about carrying on this community fitness kind of legacy you've built, and maybe some advice on how other communities can get started who are not as established? I know it's a loaded question.
Yeah, I'm afraid
where do you start?
in terms of,
No, just getting a community fitness group together, or putting that inclusive messaging out there. Those are two kind of primary things that I think you've done really well. If someone else were looking to do that,
when we
not
first
to
started
spill
out,
all your secrets.
literally by word of mouth, and we had 30 people show up at our first event. Then social media came along, and that generally drove a lot of the content that we were able to put out there and tell people that all abilities were welcome. And I think it's a matter of word of mouth, positive experiences passed on, and generally people that want a social element to help reach their goals. Some people like to do it alone, for example, and that's fine. But I think a lot more people like the social aspect of meeting people who have similar goals and similar things that they want to reach. And I think it's more of a word of mouth, social media piece that we've really excelled at.
Mm-hmm. Right. And as the business owner, you've kind of supported this and fostered that.
You're seeing all kinds of groups out there. You can have groups that run from brew pubs to, different entities out there that get together. It doesn't have to be at a running store. We've seen these groups evolve over the years, and that's great for running. And I don't view it as competition. I view it as really building the running community. It's not competitive for me, because we're going to be there to help as a resource anyway. Anything that can help grow the running community is a good thing.
Right. That's awesome. Well, that's the end of my questions. If you have anything else to add, otherwise, I really appreciate you talking to us, especially knowing you just had a hip replacement surgery and you're recovering right now.
Oh, yeah.
So we hope that goes well so that you're able to better participate in your day.
Yep. Thank you.
Awesome.
I'm glad. Thank you for letting me participate.
Definitely. Well, thank you so much, John.
All right. I hope you and Tim are doing well. Take care.